June marks Men's Health Month, a time when men are encouraged and reminded to make wellness a priority and to get some of the important screenings for health risks. So here to talk about that now is Dr. Scott Joy, the medical officer of Health One Physician Services Group. Dr. Joy, first of all, we know that men aren't widely known for putting their health first. Tell us a little bit about why that is and why it's important for men to put more emphasis on their health.
Yeah, I think there's a lot as to why it is. I think it's just been a culture of men to kind of put things off and minimize symptoms. And I think what we're looking for preventive visits is to kind of identify problems before they cause symptoms. So that even makes it more challenging. But I think it's a good idea for patients, particularly men who are older than 50, to have a yearly exam. I think younger patients should have an exam at least every 3 to 5 years. And if they're on a chronic prescription, they should be seeing their physician once a year.
All right, that's great information. Walk us through some of the biggest health concerns for men as well. And we know heart disease has always kind of been the top of that list.
No, I think heart disease is always at the top of the list, and cancer as well, and then making sure that we're protecting everybody against the infectious disease that we can with being very aggressive with vaccines. So I think with heart disease, what's important is to know what your baseline blood pressure is. And I think the other thing that a lot of men don't appreciate is what their 10-year risk of heart disease is. So in the past, we focused on what the cholesterol number was. And now I think the important point for your viewers is to know what your 10-year risk of heart disease is. A good one is less than 7.5%. Anything higher than that requires further evaluation. So a good idea to get in, talk to your provider about how you calculate that. It's based on blood pressure, age, chronic conditions, if you smoke or not. But that's a real good number for men to know.
Absolutely, so important. You kind of mentioned the cancers too. We know prostate cancer, colorectal cancer significantly impact men. What should men be thinking about when it comes to cancer?
So I think men 45 and above should be having a discussion about what colon cancer screening is most appropriate for them. I think a lot of guys have been concerned about colonoscopies in the past, and now it's nice that we have other tests that we can offer. We can put a kit in the mail, and that patients can send a stool sample back through the mail. And if you don't have any history of polyps or family history of colon cancer, that is a very appropriate test to get every 3 years. I think the key about prostate cancer is a little debatable about the frequency of that. I think key questions that I ask patients are, do you have a family history of prostate cancer? And clearly, patients who are African American have a much higher risk of prostate cancer. So those are men that should be screened more aggressively.
Absolutely. And are there any other screenings that we haven't talked about yet that men should be doing or thinking about?
Yeah, I think we talked about vascular health, and there's one that I think is really underutilized in men who smoke. And this is men who smoked a total of 100 cigarettes over the course of their life. If they are 65 to 75 years of age, they should have an ultrasound done of their abdomen. And what we're looking for is an enlargement of the aorta, the large blood vessel that runs through the abdomen. This is something that if those break, it is a high mortality rate. Men are likely to die if that happens. So it's a simple ultrasound to get if you have even a small smoking history, 100 cigarettes throughout your entire life. A simple ultrasound can save your life. So I think that's an important one for men to be aware of.
Wow, absolutely, and often probably not thought about as well. What else can men do in their just everyday lives to stay healthy? Any tips for that?
Yeah, you definitely don't want to take up smoking. You definitely don't want to drink more than 2 drinks of alcohol in a day. You want to try to get 30 minutes of exercise 5 times a week, and that doesn't need to be hardcore CrossFit. It can be just simple walking. That's been shown to improve mental health and cardiovascular health. And the other thing that I think a lot of men, particularly men as they get older, ignore is hearing loss, because hearing loss is one of the most preventable ways to reduce the risk of developing dementia later in life. So if a lot of guys and their wives often come in and say he can't hear very well, that's something we really are very aggressive at evaluating and treating, because we know if that's left unchecked, it can lead to dementia later in life.
Wow, that's so interesting. Awesome. Well, thank you so much for your time and all this information, Dr. Joy. We know it'll be really helpful for a lot of people, so we appreciate it.
Yeah, thank you.
Absolutely. We'll be right back.